Hello everyone, myself Dr. Meghna Nigam, Senior Lecturer in the Department of Periodontology at Babu Banarsidass College of Dental Science, Lucknow. My today's topic for the presentation is periodontal ligament. What is periodontium? The periodontium comprises of the gingiva, cementum, alveolar bone, and the periodontal ligament, thus introducing me to the topic and the lecture for the day of periodontal ligament. Now, what is periodontal ligament? By definition, it is a complex vascular and highly cellular connective tissue that surrounds the tooth root and connects it to the inner wall of the alveolar bone. It is also called by the various names of periodontal membrane, alveolo-dental ligament, desmodont, pericementum, dental periosteum, and gumphossus. The average width of this periodontal ligament space is 0.2 millimeter, which increases in the case of hyperfunction such as trauma, bruxism, etc. And in cases it can also decrease like in hypofunction or non-function of the teeth like unerupted teeth. The basic shape of the periodontal ligament is that of an hourglass appearance, which means that it is thinnest in the middle third of the root. Radiographically, it is appreciated as the radiolucent area between the teeth and the alveolar bone. The basic composition and the structure of the periodontal ligament is made up of the cells and the extracellular substance. The primary cells are the synthetic cells, means the ones which are involved in the formation of the periodontal ligament. The resorptive cells, which help in the resorption of the periodontal ligaments. Then the progenitor cells, the epithelial cell rest of Malleus, and the defense cells. The extracellular substances include the fibers and the ground substance. I will be covering each of these cells in detail. The first are the synthetic cells. The first is the fibroblast among it, which is the predominant cell of the periodontal ligament. It is basically ovoid or elongated cell with the pseudopodia-like process. It is also parallel to the principal fiber and synthesize collagen. It gives rise to the cementoblast and the osteoblast, and at the same time, it also phagocytoses and degrade the old collagen fibers. The next group of cells are the osteoblast. As the name suggests, they are the forming cells of the alveolar bone. They line the tooth socket, and these cells migrate to the surface of bone via body of the periodontal ligament. The next group of cells are the cementoblasts, which help in the formation of cementum. They deposit the collagenous matrix of cementum, which then mineralizes. The other group of cells are the resorptive cells. As the name indicates, they bring about the resorption of the different components of the periodontal ligament. The first among it is the osteoclast, which resorbs the alveolar bone. It is multinucleated cell. The part of the plasma membrane adjacent to the resorbing bone forms the ruffled border, and this ruffled border is surrounded by the clear zone. Next group of cell is the cementoclast. Now, as a cementum does not undergo remodeling, the cementoclasts are absent in the periodontal ligament, but they are found in certain pathological conditions such as resorptive process of orthodontic tooth movement and the shedding of deciduous teeth. Next group is the progenitor cells. These are undifferentiated mesenchymal cells which undergo mitotic division to form the fibroblast, osteoblast, or the cementoblast. Next is the epithelial cell rest of Malleus. These epithelial cell rest of Malleus are the remnants of Hertwig's epithelial root sheet, which disintegrate during the development of the root. They are either appear as an isolated cluster of cells or interlacing strands and are found in close apposition to the cementum. With the increase in age of an individual, these cells decrease in number because either they degenerate or they undergo calcification to form cementicles. They also participate in the formation of the lateral root cyst and the periodontal cyst. Next group of cells are the defense cells, which comprise of the mast cell, macrophages, and the eosinophils. The next group of the periodontal ligament composition is the extracellular substance, which includes the fiber and the ground substance. The fibers are primarily collagen, elastic, reticular fibers, indifferent fiber plexus, and oxytocin fibers. The ground substance are that of the proteoglycans and the glycoproteins. Let's talk about collagen, the first fiber. This is a basic principal fiber of the periodontal ligament. It has a wavy course. The arrangement is such. The terminal portion of this principal fiber, which is inserting into the cementum and bone, is also called as a Sharpie's fiber. The amount of collagen in the tissue is determined by its hydroxyproline content, and it maintains the framework and tone of the tissues. Collagen is therefore synthesized by the fibroblast, chondroblast, osteoblast, odontoblast, and other cells. The main type of fibers which are found in periodontal ligament, the main type of collagen which is present is type 1 and type 3. The collagen is arranged in a form that it forms a tropocollagen, which co-aggregates to form the microfibril and finally a fibril. Now the fibrils, they have a striations with a periodicity of 64 micrometer due to the overlapping of the tropocollagen molecules. Now let us see about the principal fibers, the principal collagen fibers of the periodontal ligament. These fibers are arranged in the manner or the sequence in which they develop during the tooth formation. Now the first group of fibers are the transseptal fibers. They're the first one to form, and they are basically present, they attach onto the cementum between the two adjacent teeth. Okay, they have no osseous attachment. Therefore, sometimes they are not considered a part of periodontal ligament, but a part of the gingival fiber. The next group is the alveolar crest fibers. They originate from the cementum just beneath the junctional epithelium and extend towards the alveolar process. The main function of these alveolar crest fiber is it prevents the extrusion of the teeth. The next is the horizontal group of fibers. They are oriented perpendicular to the long axis of the teeth and attached to the osseous surface. The other group is the oblique fiber. They run in the coronal direction from the attachment of cementum on one side and attach onto the alveolar bone on the other side. These are the main group of fibers which are responsible for the transmission of the occlusal forces to the alveolar bone. The next is the apical group of fibers. These run from the cementum apically from the root surface, and they are absent in the cases where there is a blunderbuss root or if the roots are in still the stage of development. So it is only seen in the teeth where the root formation has been completed. The last group of fibers are the interradicular group of fibers which are seen in the furcation area. The next group of fibers are the elastic fibers and the oxytocin fibers. The mature elastic fibers, they include the oxytocin fibers and the elastin fibers. Now, oxytocin fibers, they are parallel to the root surface in the vertical direction and they attach to the cementum in the cervical third. They are thought to regulate the vascular flow. Likewise, the elastin fibers are the bundle of the microfibrils which are embedded in the amorphous elastin. The next group of fibers are the reticular fibers. They are immature collagen fibers with argyrophilic staining, and they are related basically to the basement membrane of the blood vessels which lying in the periodontal ligament. Indifferent fiber plexus are another group of fibers. They are the small collagen fibers which are associated with the principal fibers, but they run in all the directions to form a plexus. Now next we come to the ground substance of the periodontal ligament, which is comprising of the proteoglycans and the glycoproteins. Now ground substance is nothing but a gel-like matrix which is secreted by the fibroblast, and it fills up the space between the cells and the fibers. The composition is that of glycosamine glycan, predominantly hyaluronic acid and proteoglycans, and the glycoproteins which consist of the fibronectin and the laminin. Now, like any other tissue in the body which has a particular blood supply and the nerve supply, the blood supply in case of the periodontal ligament, in case of maxilla, is by the anterior and posterior superior alveolar arteries, infraorbital artery, and the palatine artery. For the mandibular, the periodontal ligaments are supplied by the mandibular artery, sublingual artery, mental artery, buccal, and the facial artery. Now, the blood supply, which is also present around the periodontal ligament space, is from the apical group of arteries, which are entering directly into the pulp through the root apex, the arteries from the gingiva, and the alveolar group of arteries, which exit through the alveolar bone into the periodontal ligament space. Coming up next to the the nerve supply is derived from either sensory, that is the trigeminal nerve, or the autonomic nerve supply from the superior cervical ganglion. Now, when we talk about the sensory nerve supply, it consists of the myelinated nerve fibers, which are present apically, and as the nerve traverses coronally, it loses its myelin sheath, and it may terminate as either the free nerve ending, which are responsible for the pain sensation, or the Ruffini and Messner's corpuscles, which are responsible and the key mechanoreceptors of the periodontal ligament. The autonomic nervous system is responsible for the activation of smooth muscles, which are associated with the vasculature within the periodontal ligament. Next is the function of periodontal ligament, very important. First is the physical function. Now, when we talk about the physical function, the periodontal ligament, it provides a soft tissue casing, means it is protecting the underlying vessels and the nerves from the mechanical forces which may otherwise injure the delicate tissues. Next is it helps in transmission of the occlusal forces to the alveolar bone. It helps in the attachment of the teeth to the alveolar bone and maintains the gingival tissue in the proper relationship to the tooth. Now, a very important function of periodontal ligament is it resists the impact of occlusal forces by shock absorption. Now, when we talk about shock absorption, the basic mechanism of shock absorption has underlying two theories, two very important theories. The first is the tensional theory. Now, according to the tensional theory, it is the fibers which play a very primary role in transmitting the occlusal forces. Now, how does this theory works? It says that when the force is applied on the crown, the principal fibers unfold and they straighten. As a result, the forces are transmitted to the alveolar bone. Now, once the forces are transmitted to the alveolar bone, it causes the elastic deformation of the bony socket. And when this deformation reaches its threshold limit, the load is transmitted to the basal bone. So this is one theory, that is a tensional theory. The second very important theory for the mechanism of shock absorption is the viscoelastic theory. According to this, it is the movement of the fluid which plays a primary role in the transmission of forces, and the fibers play a secondary role. So here what happens is, first the force is applied on the tooth, the extracellular fluid from the periodontal ligaments escapes to the marrow spaces. Because of the depletion of fluid, the fibers, they tighten, the blood vessel stenosis occurs. At a time, arterial back pressure is created, which results in the ballooning of vessels. There's a passage of blood with ultrafiltrates into the soft tissue, and the lost fluid is finally replenished. The another important function of periodontal ligament is the formative and the remodeling function. Now, when we talk about the formative function, it definitely means the formation of the alveolar bone and cementum. And since this is the key requisite for the periodontal regeneration, it is seen that the periodontal ligament plays a very important role in the periodontal regeneration once it has been diseased and the treatment is provided. Now, when we talk about the remodeling function, it means this remodeling is taking place, or the periodontal ligament is helping in the remodeling during the orthodontic tooth movement or the accommodation of the periodontium to occlusal forces, or in the cases of tissue repair. The next function is that of the nutritional origin. And our periodontal ligament supplies the nutrients to the cementum, bone, and the gingiva by the way of blood vessels, and also provides the lymphatic drainage. So basically what it is doing is it is providing the anabolites to the cementum, bone, and gingiva, and at the same time it is also removing the catabolites. The next group of function is the homeostatic function. Now the term homeostasis means to maintain something. So the periodontal ligament is is having a homeostatic function by maintaining the width of the periodontal ligament space. So this is because the cells of the periodontal ligament help to synthesize as well as resorb the extracellular substance of pedial cementum and alveolar bone connective tissue. So there cannot be the excess deposition or growth of a cell, or it cannot be excessive resorption of the cell. So a balance is maintained, thus the width of the periodontal ligament space is also maintained by the PDL. Next is a sensory function. This sensory function is provided by the PDL because it gives a feedback during the masticatory cycle and helps in the transmission of pain and pressure sensation. So thus we come to a conclusion that it's a fibrous connective tissue forming a very important part of the periodontium. Functionally, it is very small but plays a very important role in the proprioception and bone remodeling. And since this periodontal ligament, as we studied about the undifferentiated mesenchymal cells, which were the progenitor cells, they have a pluripotent nature and it is helping in this periodontal regeneration. Thank you.